Hello, everyone, and welcome to What's Wrong with the Podcast. Hope you're all safe and well. Today, we're delighted to be talking to Courtney Williamson. Courtney is the CEO and founder of AbiliLife, a biomedical device company developing products to improve the posture, balance, and quality of life for elderly and neuromuscular patients. AbiliLife's first product, the Calibrace Plus, is a back brace that has a patent, is 100% reimbursed by Medicare and commercial payors, is patented, and is an FDA-registered device. AbiliLife's future product, the SmartCalibrace, is a clinical wearable device embedded in the Calibrace Plus to monitor motor symptoms in real time to indicate fall Courtney risk. Founded AbiliLife as a doctoral student at Carnegie Mellon University's Tepper School of Business, where she realized the need for a product to help her mom, a 25-year Parkinson's disease patient, with her posture. Before Courtney's mom passed away, Courtney invented the Calibrace Plus that has developed into a full-service medical device company that will change the way the geriatric population shops for medical equipment. Hi, Courtney.
Hi.
How is everything considering?
Everything's okay. I am staying at home. So you're in my home office now. And definitely just trying to manage our operations from home.
Well, thank you for having us virtually at your home. Please do tell us about yourself and how you came to create AbiliLife.
Yeah. So my name's Courtney Williamson. I am the CEO and founder of AbiliLife. We've been around since 2014. And I started my company based out of a personal need that I saw in my family. So my mom had Parkinson's disease for about 25 years. And before she passed away, she had horrible posture imbalance. So she was like constantly hunched forward. And I thought that I thought at the time, I thought it was just something that she was suffering with. I didn't know that it was connected with Parkinson's disease. So I was studying at Carnegie Mellon University, which is based in Pittsburgh, Pennsylvania, getting a PhD at the Tepper School of Business and Organizational Behavior. So my goal and dream was to become a business school professor, but I had this mom who was ill and I was trying to find a solution for her. So long story short, I ended up going to Project Olympus, which is Carnegie Mellon's business school incubator for like startups. And that's a part of their larger Schwartz Center for Entrepreneurship. And I said, hey, I have this problem. I don't know how to build something. It might be a medical device or an assistive device. Do you have any engineers that could help me? Because Carnegie Mellon is renowned for its engineering. So at the time they said, sure, you can join our program, but you have to write like a 1-page sort of business summary. And I was like, well, I don't want to make this a business, but fine, if that's what I need to do, I'll do it. So I sat down and I was completely blown away because I did the research and I found that there's 1.5 million Parkinson's patients in America. There's about 10 million worldwide, and 70 to 90% of them had the same problem that my mom had.
Wow.
So then at that point, I realized like this is actually a big market. And then I started looking at posture and balance in general and what makes some roll over or fall. And then I started looking at the elderly population, 65 and up, and how there's a huge percentage of those people who, because of osteoporosis or kyphosis, they are actually hunched over, maybe not to the same degree as Parkinson's patients, but they actually experience falls. So it blew my mind. And so I finished up my degree, got my PhD, and then launched into AbiliLife, and have been moving ever since. And the product that we have that is currently on the market is called the Calibrace Plus back brace. So it's a back brace specifically designed for patients to lift your shoulders up and back and give you support across your entire torso. So it is reimbursed by insurance. We've sold at least one unit in every single state, and we're looking at selling internationally, but it's been such a huge journey. And I think now, given the pandemic, people really don't understand. I know I didn't understand the healthcare system and how it actually is built. And now we are really upset because we're learning that there are major holes in the system, not necessarily the care,
Yeah.
So there's a whole difference. I'd love to get into that because when I started my company, only thing I knew about in healthcare insurance was that I got my card every year with my healthcare insurance, either from my school when I was a student or when I was with my parents, it would come through my dad's, his company, or, buying it myself. And that was it. And then I would go
Right.
in and I would give them my insurance card. I would go get seen. I'd get the medication. And that was literally all. Maybe I had to call the 1-800 number to like make an appointment with a doctor that I'd never seen before. Other than that, that was it.
Right.
When
Right.
I started my company, I started to realize the immense holes and gaps in our healthcare system in the infrastructure. And that's what actually made me change the way that I thought about my own business model.
Let's please go into that because I
Yeah.
think, as you said, we know so little. I mean, we
Mhm.
understand like the like the superficial problems that like, oh, okay, like healthcare insurance is really expensive. We don't
Right.
necessarily know why, or we
Right.
know like there is dysfunctionalities and it's like, why is it so hard to get an appointment or to see a doctor, or why aren't there enough beds? Although like you're like one of the biggest countries and economies in the world. And you see these like gaps, but it's such a convoluted system and it's complex, maybe
Mhm.
on purpose, so that we don't understand and we cannot
Right.
really relate to or question how things are. So yeah, we're always trying to like go and understand the underlying reasons of why we're facing some problems. So please, would love to hear the process that you went through and what.
Yeah, sure. So I'll start with my process. I naively thought that if I could build a product, and then go to Medicare and say, I have this product, I built it to the specifications that you've required to get reimbursed.
Hmm.
Can I get a reimbursement code? Fine. I did that. And then I was like, now I'm off to the races. And then it was not so fast because I was not authorized to bill any insurance company at all. So if you think about it, you go into the doctor and every 15-minute increment is something that they're charging back to your insurance. If
Hmm.
you need to have any sort of medicine or equipment, it's almost like a charge card. If you think about your insurance card as like a charge card, right? Where you are charging against your account, which is your
Hmm.
insurance plan that you have for the year or for that period, right? Okay. So for me, I said, well, I need to find a code that insurance will allow. They'll say, yes, we will pay for this product, right? So
Mhm.
my code is L0457. That's the actual code that my code is under. Okay. But have you ever like written into your insurance and say, hey, I bought this medical device or I got this medicine and I need you guys to reimburse me. Here's the cost, right? Like you've never done that.
No.
That's because that's not how that works. When you leave the office, what we don't see once you leave, or maybe while you're in your appointment, the staff at the front desk, as they take you in and say, what's your name, date of birth, here's your forms, fill it out, go sit down, here's
Mhm.
the doctor, they're typing in information, your insurance information, your date of birth, all the stuff that they put on that form, and they're actually electronically sending it to a clearinghouse, which is where the communication begins between your provider, which is your doctor's
Hmm.
office, and the insurance, right?
Okay.
And then the insurance goes, okay, yes, we know her. She's has an active insurance plan, and yes, we will cover it. So instead of you paying $120 out of pocket to go see your PCP, now you're paying your $20 copay. And
Mhm.
now what happens to that $100? Where does that go? Well, your insurance covers it.
Mhm.
Your insurance actually gives your PCP $100. So with your $20 bill that you gave them at the front desk before sitting down, and then their $100 that's being wired into their account, now your primary care physician has $120 for your one visit, right?
Right.
Okay. So then you're like, okay, well, how do insurance companies make money if they're always giving money? That's where your insurance premium comes in.
Mhm.
So now let's say you spend $200 a month, and that's on the low scale at this
Yeah.
point. If you spend $200 a month, but you only went to one doctor's visit because you were really healthy, who's making out?
Oh my
Yeah,
God.
right? So now the insurance, yes, they gave your doctor $100, but every month you give them $200 because what they're doing is they're banking on you being healthy.
Yeah.
So when you see these insurance programs roll out, like we want you to help stop smoking, we're going to give you this free program, or we're going to give you a dietitian. It's because they want you to get healthy so that you don't use right? Because if you have lung cancer and
Yeah.
you have to spend money, they are on the hook to spend money to get you well. And they have to authorize anything that the doctor says within their scope to get you well. They
Right.
don't want you to do that. They don't want you to be overweight, because the complications and the comorbidities of being overweight are way too much. They want all the money. So in the way, do you want to be healthy? Yes. And so your incentives are aligned with the insurance. Who wants to be unhealthy? No one does. So
Right.
you do your best in general to be healthy, but don't forget, you're still paying them $200 a month, and
Yeah.
you only spend. So then it's like, well, should I be going to the doctors every month, right? Just to make it
You're
right.
you you're paying that for the what if, right? Like what
Right.
if?
It's the
Yeah.
what if, it's the contingent, it's the
Yeah.
insurance, any type of insurance, whether it's auto, home, renters, whatever. Insurance is a hedge. You're hedging your bets. You're like, well, I want to be as conservative as possible. I don't think I'm going to get ill, but if I do, I want protection. And
Right.
it's one of the hardest things for humans to do, is to think about in the future
Right.
what will happen, right? Like we're such an instant gratification. Like, I want to eat this meal now, so I'm going
Yeah.
to eat it now. You're not thinking 10 months from now what you're going to eat. You're thinking, I'm hungry because it's lunchtime now, so
Yeah.
I'm going to satiate myself now. So in the future, it's like nearly impossible for insurance companies that have incredibly smart statisticians and models and have been doing this for centuries. They know, they can look at your health records and guess if you're going to get sick, if so,
Wow.
how sick you're going to get, and how much money they'll have to pay. They always end up making more off of your plan than you end up spending. And
So
for the
my
ones,
health is financial forecasting for them.
it's financial forecasting, and that's what it is. I'm not saying it's bad. I
Well,
always
it's
encourage,
smart.
right?
It's
It's
yeah.
very smart, right? So then you think about, okay, so now you're thinking about what's going on right now and in the health system in general, right? So let's bring it back. So my brace. So I said, okay, I'm not a provider. So what did I do? First thing I did was, maybe I should find somebody who is a provider. Maybe I should find distributors and start talking
Mhm.
to them. But here's what they hit me with. Hey, we love this idea. Your brace is too expensive, because I was manufacturing in the US. My manufacturing plant is in Columbus, Ohio.
Mhm.
And I was manufacturing in the US, and they're like, it's way too expensive. Can you give it to us for, they wanted it for like 3 times less than what I was
Mm.
selling it to them. I said, like, I can't do that, because if I sold it to you, then I can't even cover my cost of making the unit,
Right.
let alone any sort of profit. There's no way. Kept on having conversations back and forth. I said, you know what? It's time for me to become a provider. So I became a medical provider. So
Wow.
AbiliLife is a durable medical equipment provider. And we did that to provide, for the sole purpose of providing access to patients with this product, because we knew they couldn't afford it out of pocket. And we knew that distributors weren't willing to play with us. So they wanted us to bring it down to like rock bottom prices that were just not sustainable for a
Right.
startup company. And then we had patients who needed this product like yesterday. And I said, I have to make a channel.
How long was that process?
That was a 9-month,
Wow.
60 email to impromptu visit process. And I'm happy it was, because you shouldn't just let anybody become a provider.
Sure,
There's
that's
already
true.
enough medical fraud as it is, which I'm very passionate about and get so frustrated about. So anyway, so you go ahead and do that. But back to the part about the distributors, which is very germane to now. They said to me, your product is too expensive. Go to China and get it made cheaper. Come back to us, then we'll think about buying it.
Hmm.
Well, if I had gone to China today, I would not have product to sell to patients. Part of the problem and part of this issue that no one paid attention to is, while you're paying your insurances crazy amounts of money a year,
Mhm.
right? And then they're paying hospitals and everybody's getting paid. Well, how do we cut margins? Because you want more profit. How do you squeeze more profit? The only way you can squeeze more profit is to make more money, which they always increase the premiums and medicine's getting more and more expensive, et cetera. Think about the EpiPen debacle, right? But also, if we lower costs, we can have more. So what do? It's too expensive to make anything or to do any business in America. If you think about calling a store's 1-800 number, you're getting routed to India to talk to a representative because no one is paying a rep to sit in New York or Seattle or Pittsburgh to actually answer the phone. So they're shipping everything off. Well, now the China's like, hey, we're in the middle of a pandemic and our nation is like dying. We have people who are literally dying in the streets. We cannot go to work. Everything shuts down. So when you look at us, we're the wealthiest nation, yes, but it was a cost, at the cost of not controlling our supply chain at all.
Wow.
At all. And so to build a hospital, whatever hundreds of millions, if not $1 billion to build a state-of-the-art hospital now, right? We can't have enough hospitals and enough beds for people because that will require American workers and paying them a living wage to come in and lay the brick and put that together, which we already don't do business in America.
It's crazy.
So it's this cycle, and it's not just in healthcare. You're looking at other companies, other tech companies that will not make it at all because they never were doing business in America. They were selling to Americans. They were doing the actual business overseas. Now that's not an option.
How does such an integral part of just a country, a government, a system like healthcare can be reliant on one other, it's not even like we're relying on 20 different countries. We have a backup strategy if something happens there. I was listening to Cuomo's talk on access to ventilators and how there's a huge shortage of ventilators. And now, of course, the provider of ventilators is China, and everybody's competing for the same ventilators, all states, federal government, private hospitals. It's no different than just a new company who didn't plan their supply chain well. How did that happen? And how was that allowed for?
Okay. So America is built upon exporting and importing, to be, politically correct, importing people and resources to build it and its infrastructure. If we're going to be 100% honest, it never was as self-sustaining as we pretend to be.
Yeah.
And Cuomo said, he said, it was really funny. He was like, well, America was, what are you talking about? Make America great again. It wasn't really that great, right? Look at where we are now. We're one thing is unraveling everything at the seams. It was never something that we truly sat and had the citizens actually build from the ground up and keep it that way.
True.
And so for a very long time, since its inception.
True. It's actually a money-making, a country with a money-making goal.
It is a startup that did not manage its supply chain.
That is
so when you think about that, you're like, I see why it happened. I totally get why this happened. It's crazy to see, and it's heartbreaking, and it's startling, and it's tiresome. I don't know about you, but I've been very tired these past few weeks because it's just tiring. Everything is tiring.
It's exhausting, emotionally exhausting. Yeah.
It's emotionally exhausting, right? And so, but so you sit here and you're just like, well, here's the thing. Even if you look at our housing, for instance, right? And you look at these, pour water on them and a house sprouts up in the middle of the, of a county or in the middle of the suburbs, right? And it's this cheap material that we're using. We're kind of putting stuff together, slapping a house together. And then now you have all these, I think they're called Ryan homes or something like that, where you have these like huge like McMansions, right, that you just put in the hillside someplace, and then a family of 4 moves in, right? Like, and then we found out years ago that, well, that's not super sustainable. We were giving people more money than they really had access to,
Right.
and they couldn't keep up, right? Like, we always do this. It's just
We never
been at
learned.
such, it's been so contained though, because it wasn't the whole world.
Right.
It was like, oh, well, you guys made it. Okay, we'll fix this. It was contained. It was isolated. It was like a fire that you could kind of keep in the back room and then put the firewalls up, and then it's contained there. Yeah, that back room is inoperable. You can't use it for a while, but the rest of the house is fine. Now it's like, nope, everything is burning down. Where's the infrastructure? You don't have a brick wall at all? No, it was all made of paper. That's a problem.
Like masks.
That's a problem.
Like swabs.
Correct.
Basic
We
things.
don't have cloth masks.
Oh my God.
Now, if you think about that, and you think about how much cotton America, you know, there was a one time where cotton was a huge industry in America, and again was manufactured, you know, by slaves coming from Africa. Make all this cotton because we can make clothes, we can make sails, whatever.
Yep.
You're right. Okay. Now, how ironic is it that we don't have the manufacturing power to make cotton masks? I think the colonizers are probably rolling over in their graves at this point because it's a cotton mask. And didn't we set up the cotton industry? Yeah.
Like, aren't you leading in like science and technology? You know, it's
we're not, because, and so when I think about my company, for me, as I was looking at this system, because I said, so let me get this straight. You want me to go over to another country, make this product for a very low price, sell it to you, so then you can sell it to my patients, and then you can sell that claim to their insurance, right? Like, what happens if you and I don't get along one day, or you decide to go out of this industry and pivot? So then what happens to me? What happens to my patient, who now can't get access? That was way too much for me. And I brought everything that I could in-house. Amazing. Everything is in-house except for, you know, legal, accounting. And then of course we have contract sewers who manufacturers. Right. But like, because I just was like, you have to have control over your supply chain. And as 100%. A nation, we do not.
How many, like, I guess it's like such a like process that requires not only patience, but like really will to be able to like pursue that too, because they make it, it's designed to be difficult and cumbersome on purpose. They don't want you to, you know, become a provider yourself. The distributors want to get you for a low price. So like, if we look at, do you have any idea on, if we look at the, you know, innovators or products in healthcare system, like how many are there like you? You know, how many unicorns are there in the country?
I think that the great thing about it is that America is very innovative. Yeah. You can't take that away. Like, you know, we might not have masks, but we make really very innovative, very groundbreaking products and procedures. And so I think that for me, I found my innovation in university settings. Our universities are some of the most amazing universities. And right now they are working tirelessly to find a vaccine, to build better tests. Like, I mean, they're really brilliant. Yeah. And I think that needs to be talked about and commended. That being the case, there is a difference between making a product and making a business.
Sure.
There is a total difference between that. There's a difference between that. And building the infrastructure for your company is a whole nother beast.
Yeah. And it could be discouraging, very much so.
Right. Oftentimes you don't have one person who can do both. Well, I couldn't physically build my product because I'm not an engineer. My mind does not click that way. Mm-hmm. But I surrounded myself with people who did know how, but I knew how to build my company. Yeah. Like, what do I need? You know, even if I had never done it before, well, but that doesn't make sense. Why do I have to sell it to you to then sell it to somebody else? I don't really get that. What if the supply chain breaks? No, I'm going to go and make myself a provider and try to figure that out.
Yeah.
That's what I worked on doing. There's a lot of people who don't go that route, and in fact have been encouraged by their investors to not go that route, to build something on an already existing infrastructure, because it does allow you to scale quicker. If I had agreed years ago to sell my product for cheaper and just to sell to distributors, I would be making a ton of product to be putting out in front of patients. But at this point, I really am glad now looking back that I didn't, because I would be in the same position where it's like, well, we don't have access to this product, and we don't know when China's going to open back up again.
But even with that, like, sir, I think there's such a human-centered approach in what you did. Like, and I think I commend you in the sense, like, it goes back to you being like, you know, a hard worker, like really, even if you didn't have business experience, like going at it and figuring it out. And the background of all, you were a caregiver, right? Like you actually understood your patient like the most, and you really wanted the best for them. Like, I think, you know, there are so many, you know, highly innovative, amazing medical like appliances or like, you know, wheelchairs, prosthetics, like those companies out there that, I mean, insurance doesn't cover them. And I don't think, and like most of them are not trying to do anything about it. And I know so many people who are struggling with, you know, insurance going to see what they would cover or it wouldn't cover. So they try to work around it, or they try to use some subpar device that it actually doesn't meet their need, but that's what insurance covers. You know, like this is an ongoing pain point for so many people. And you like, you took the risk of maybe not being able to get investment or taking a longer process, but really understanding the end user and how to best cater to them, which is why you will be sustainable. I mean, not only because you created a more solid supply chain, even more so than the government itself, but also you didn't, because I think in business, like so many times we try to cater to the middleman, right? Like even we see this in architecture, like even though you're going to live in the house that I will design, the developer suddenly is the architect's client, and then the priorities get skewed. So same in insurance. Like if you were targeting for the investors or for the distributors only, you would have faced like so many other problems. But the fact that, I mean, not only there is a market now, we're facing a much larger aging population in the future. And with the current healthcare system, who knows if we're actually going to be able to drop down the disease or disability rates, right? Like, who knows? And people, and I also like have to commend younger generations, like Gen Z and onwards. I have more faith in them in like questioning systems and holding industries accountable.
Right.
I don't think they will take it. You know, like
No.
I think we just took so much shit. Like, well, I'm a millennial, so I'm like, I'm in, you know,
Me too.
you know, like maybe I go both ways sometimes, but like,
Right.
I think the former generation, they were just so patient, and they just, oh, so it is what it is. Like they went along with it. But I think the newer generations, I have more faith in them to just like hold even governments accountable to really like do something about it.
Yeah. I mean, one thing that I have noticed in this, I call it the WebMD effect, which is right, like everybody
is
now their own doctor, right? Like you're Dr. House or you're, you know, a doctor from Grey's Anatomy. Like everybody just thinks that because they can ask Siri what's going on with me, that like whatever Siri says, now they know what's happening, right?
Yeah.
And that has worked to my advantage in terms of my business, because people will look and say like, oh, I think I need this brace. Now we do require, if you want this reimbursed by insurance, you have to go to your doctor, you have to get a prescription form. We have a full prescription form,
Right.
You have to get charted. So we do, so the doctors aren't just, you know, being like forced into this. It's something that they believe is clinically sound and it's important for their patients. So there is that conversation. We have that open conversation with, I think now we're up to like 180 clinicians
Mm.
that have, are actively writing prescriptions. So they understand what we do, and we send them packets, and this is what we do. That being said, one of the things that I saw back in late 2014, early 2015 was, I was like, I want to create a telehealth app and a wearable that will help patients keep better track of their symptoms and also give clinicians objective data. So when they're going into their doctor's appointments, their patients, that they see what's actually happening. So when you think about the chronic disease of Parkinson's, just as an example, they might see their doctor once, maybe twice a year, right? And they might not be seeing a movement disorder specialist because it depends on the area that they're in. They might not have access, right? So they have to remember 6 months of symptoms. Well, that's a bit tricky because you can have 40 plus symptoms at any given moment just for Parkinson's, not the other comorbidities that they might have. So, but the doctors are reliant upon that information to make therapy and prescription decisions, right? And so it's just terribly difficult for the doctor and for the patient. And you only have like 20 minutes with the doctor, maybe a little bit longer if you can squeeze that in. So I wanted to work on that. And so we're still working on building out what this wearable might look like, and how this can be integrated. But I think that timeline is going to be sped up now that we're in this pandemic, because honestly, most patients don't want to go into their doctor's office right now.
Sure. Yeah.
And they, and they're older, and they don't want to go in. But their disease is going to continue on during this pandemic and after, unfortunately. There's not going to be a cure for the disease after the pandemic has subsided.
Right.
So they're having these symptoms now. But what are they doing to keep track of it? I know I missed a dentist appointment yesterday. I'm not going to the dentist, and I don't even think my dentist is open, right? But that's a regular cleaning. It's fine. It's nothing. I don't have any symptoms.
Right.
Nothing's going on with me. What if I had something where I had symptoms? So I think the telehealth is going to completely accelerate. And this is going to be sort of the kick that we need. I'm worried about when flu season, not the COVID-19, but flu comes, and people have just the regular flu, but there are symptoms that feel like COVID. Are you going to now storm to the hospital because you're anxious?
Right.
Understandably so. But do you have the flu or do you have COVID? Like, those types of things are incredibly difficult to wrestle with our existing climate. When you think about the younger generation, they don't like going face to face with anything.
Sure.
And they will find a way to use an app or to get on the phone, through an app or a computer for most of their things. Now, these students, these kids are now they're students, and they're all learning virtually, all of them, right? If you think about that,
Crazy.
that whole generation will have experienced online learning. That whole, within the matter of a weeks, they are all online learners. Who's going to sign up to go into a brick and mortar university now?
So true. What's going to happen?
Why? Yeah. Why would you pack up, go to Bed Bath & Beyond, buy way more stuff than you need, load it in
much more cost,
van, drive it across the state or drive it across the country, unpack, get to know a roommate you don't want to know, right? Why would you do that when you proved that you could stay in the honor roll as a middle school student or as a high school student online in the middle of the pandemic? Why would you go? Why? Are you now going to demand that Harvard have online courses because you just don't want to you want to stay at home and you want to save money? You don't want to pay their room and board.
Yeah. I mean, we were talking about this like in New York City. I mean, yeah, partially if you have all the means, some people come for the experience, right? Although right now it's a very different city, but normally you come for the experience. But still, there are so many students here that is very hard for them to be here, and they risk a lot of things to be here.
Mm-hmm.
Maybe they will feel more financially secure in the future and then come. They won't have to come just because their school is here. So true. And they will be used to it already.
We will have a generation of students that's used to doing school online, the whole thing.
Yeah. And so why would you even go to, there's nothing even pleasant about the experience of a hospital. Why would you want to go to a hospital at all?
Correct. unless you have to for a routine checkup. Why do I have to go to the doctor's office?
Exactly.
If there is a sensor that can check my blood pressure, like you put the blood pressure cuff on me. If I have a sensor to do that, if I have one to check my temperature and some other things, and I can sit and talk to you, why am I going to the
Especially for
doctor?
like elderlies, people would
Right.
like, it's an extra effort, right? Like everything
Correct.
is an extra effort.
Right.
We don't have accessible transportation.
No.
Majority of United States.
And then if you work or you have a kid, it's like, listen, I'm not taking off of work to go do a physical for school. No, I'm going to do it online. Like, so everything that we've done that we like, how many moms and dads have taken off a full day of work to take their kids to get physicals so they can go to summer camp? Like, yeah, every mom, you know what I mean? Like, I can remember my mom, and she was a stay-at-home mom.
Yeah.
But if she weren't like, I mean, we have, because you have to get physicals. They want to make sure you have your shots. Of course, you have to go get your shots and things like that.
Yeah.
I'm not saying there's no need for human interaction. That's extreme. But like, there are certain things.
For some,
that it's like, you don't need. There's a meme that goes around like, now we're all going to find out how many of these meetings could have just been emails.
Exactly.
Right.
I think we're like slowly transitioning. Now all meetings turn to Zoom, suffering from Zoom exhaustion.
Exactly. But then that's only going to last but so long. You can only do that for so long before you're like, I'm tired. I don't need to see your face. I'm just going to send you a 3-paragraph email. Please respond. Thank you. Goodbye. Like, I'm finished with that. Like, why am I flying? I once had to fly across the country for a 1-hour meeting. I will not ever.
Not only not healthy, but not environmentally friendly either. Yeah. Like, we're like re-questioning everything now.
I'm never doing that again. If you want to meet with me that badly, then you better put together a whole 2-day symposium.
Exactly. And now you see everyone, the experts at Zoom and all other apps.
They figured it out. And it's like, well, you could have.
Yeah.
You didn't want to.
Testing. Why couldn't we test for ourselves? Like, well, there are no,
correct.
Which is also like maybe designed on purpose so that they don't get the real numbers, because it makes everyone look bad. I don't know. Antibody tests.
Exactly. Listen, if I can spit in a tube, mail it to 23andMe, and they come back and tell me, oh, my genetics and this, that, and the other.
Exactly.
Right. And like where I'm from. And, like, oh, you have an ancestor who was from here. Right. Like, you can do that. And I can find that out. Right. Like, I hope someone's figuring out with 23andMe, like, hey, you want to check for COVID? Like, that would be helpful.
Yeah.
It would be helpful, right? Like, you can do that DNA stuff for your dog. Like, so if we can do that for Fido, then we should be able to figure that out. And like, who's thinking about that? And I'm not saying like right now, we're in the pandemic, so I get that. Like, we can't
obviously,
like right now. But who wasn't thinking about this a decade ago, or even 5 years ago? Like, wonder if there was a world where we didn't have to have someone go to the doctor. Then the doctor, all they're doing is sending it to Quest Labs.
Right.
Now, I will say for healthcare, one of the anti-cases is Theranos.
Okay.
Which is, just as a brief background there, Elizabeth Holmes was a founder of Theranos, and she created what she called the Watson, which is apparently like this little box essentially where you could just get 1 drop of blood and it would give you all these test results of like what's in your blood. Right. So testing for various diseases, etc. Well, turns out that was a full scam. She's currently on trial now, although I think her trial's probably been on hold because everything's been shut down. But her trial started this past January. She defrauded the government investors of like hundreds of millions of dollars. Wow. I think actually like billions, because I think she was on Time's cover as like the youngest billionaire woman or whatever. And essentially all it was she would take the blood and then she would get the same machines that Quest Diagnostic had and put them in the basement of this of their company and run the blood samples there, but so many false positives, so many false negatives. I mean, just
Oh my God.
was complete, like, made no sense. There's some really interesting documentary. I think it's on Netflix about it, if anyone's interested. But that shows you, and what I am scared of is other Theranoses coming out. People who are, oh, we have the cure, or oh, we have this test, and it's really not. Right now, the FDA is working very diligently to try to fast track potential vaccines and tests. They are changing the rules and the regulations that they have had, because we are in a crisis and it cannot be business as usual.
Right.
That being said, they have to work quickly. They still have to do their due diligence.
Right.
And this is medicine we're talking about. It is
so
not
true.
It is not easy, and you have to be a full expert at this.
Yeah.
And there are some of the brightest minds in our world are working on this. And even still, there are going to be mistakes, and that's scary.
Right. But I think to your point in how you transition to remote and just make things more efficient, like I definitely like what you're trying to do on tracking symptoms, like things that at least like are just like simple inefficiencies. Why do I'm sure I will miss something to like mention in a doctor appointment. Why are some things are not held remotely? I mean, even when I was pregnant and I was having my contractions, I used an app to track the time between my contractions. And then the app finally told me to go to the hospital. Like, I think this like type of simple instead of like you like freaking out and like, again, rightfully so, especially after a pandemic, and like going to the hospital where if you don't need to. My only concern is like, similar to how the oil industry sort of handicapping the electric vehicle industry, right? Is there like for the remote transition, which could create so much cost efficiency and time efficiency and just ease for so many people who do not have the capability to just easily go to a hospital, is it done on purpose, similar to like we say the Ikea model, where there's a reason why Ikea's shipping is expensive, because they actually have the highest profit margins in accessories. So if you actually go to Ikea to get one thing because the shipping cost didn't make sense to you, you will end up buying 20 different things that you didn't need. Right. So it's more profitable if you go there. So I wonder if that's the same case for like hospitals. If you go there, you will get maybe more unnecessary treatments, or you will get charged more for different things, and they want you to be there. Like, why is the discouragement to, why are we slow in this?
Yeah, I think the trick is a couple of things. I think the technology is always quicker than we are willing to change. I think technology moves very fast.
Yeah.
I think that our systems and our infrastructures move incredibly slowly. Mm-hmm. You have to, and I empathize with hospitals, because their job is to keep people well,
right,
and to manage people's deaths, and in some cases for a variety of reasons,
right.
And they're doing it with as much medicine and information as they can, knowing that the human body is incredibly complex and we will never fully understand it. At least I don't believe we will.
Right.
And you're trying to, like, if you think about operating on the brain, I don't even know what that is. Like, how do you, that is, to me, it's truly miraculous.
Right.
To have these physicians who truly are like, there are frontline workers, like they are risking their lives right now as we speak.
Every day.
I want my patients to be well. I truly believe that. But then you look at the infrastructure that they're sitting on, that they did not build.
Yeah.
By the way, they're just working in it. And someone has to get paid.
Yeah.
So how does that infrastructure work? That's not something that they even manage. And they don't even really know about. And
it's not their job.
It's not their job. Yeah. Then you look at hospitals and they're like, it's our job to keep the lights on, because if we can't keep the lights on and provide our caregivers with what they need, then our patients are at risk. So then they lean on various things like insurance plans. And if it's a public hospital, they're leaning on government funding. And so that's why this thing, I think, feels borderline of a betrayal when you think about how our government has not been set up to manage this.
Right.
And when hospitals are like, we just want to do our job.
Right. Right.
And
Right.
we can't because we don't have what we need. It's very frustrating right now. So I feel for that, and then when you look at the government, and we've had so many shifts, because 4 years is not, or even 8 years is not a lot of time to put policies and procedures into place.
Yeah.
At all. So it doesn't matter who the president is, or it doesn't matter who the mayor or who the governor is, right? It's still very difficult to move the needle.
Yeah.
And when you see these things that are happening so quickly, but the infrastructure is simply not there to pivot with it.
Right.
It's just not. So I don't know that anyone's maliciously holding back. And I certainly don't think that a doctor would just give you, well, I will say this. I don't believe that a doctor would just give you tests or give you medicine that you did not need. I don't believe that. I do question sometimes the way that insurance is billed and the way that insurance is built. And that's been one of the biggest contentious moments in our election season.
Right.
Of what about, why can't we just all have free healthcare?
Right. Right.
That take.
Yeah.
It's not the medicine. It's not the doctors. They're trying to give you what you need. But when you go, so like a commercial I like to watch is for a startup company called Good RX. Well, now I think they've sold. And so basically it's this vignettes where it's like, I have to get this medicine for my son, but I don't know if I can afford it. And the pharmacist goes, oh, don't you know about Good RX? And now instead of $68, it's like $8 or something like that, right? The doctors are like, you do need this medicine. I can't control who's selling it for what. And there's nothing regulating that, really.
Yeah. No, I've been through it myself. Like the doctor would say like, oh, you need this. Insurance may not cover. Let me know if it doesn't cover. Then I'll try. Like they try to work around your plan.
Try to work with your plan, but everybody has a different plan.
Yeah. And you're also like, well, I know what is best for me. You just said it. And like, we're going to try to work around that, which is like an entire like weird skew system. But it's just, like you have to like let people do their job, right? Like their job is to like take care of us, right? And they're doing their best. And then yet I feel like they also have to battle with this everything else and like try to find an efficient way around it, just to make sure, like, think about the patient, think about their own careers, because like maybe not all hospitals, but some private hospitals, similar to all like profit margin interests of any industry, forces and pushes the doctors in many ways. And so they're thinking of their jobs, they're thinking of their, so it's unfair to these professionals who are trying to save lives and, cater to our health, to be pressured by all these different layers or tiers of the healthcare system too.
Correct.
So there is, like, to your point, a very, poorly built infrastructure, but it's like tiers of infrastructure too. Like it starts from the top.
It's not, you can't point at just one person. And that's the hard thing, because I think for these past few weeks, everyone's been trying to find someone to blame.
Yeah.
And the harsh reality is the first person you need to do is look in the mirror.
So true.
Right? Because we have allowed this. This is not new. That's the thing about this is not new. You've known this has been crazy. You know this isn't right.
Yeah.
You know it.
Yeah.
And yet, here we are. I mean, if you just think about buying groceries and the psychotic behavior that we all have buying groceries, and then stress eating them all within a week.
So it's not even stocking. Doesn't make sense.
You're stress eating because you don't know what to do, so you're stress eating. So now you're looking around, and then you're like, okay, fine. I'm not going out. I'm going to send these gig workers. I'm going to send these Instacart and Shipt and Mercado and all these people, and they're going to go out, and God bless them, and they're going to go get my eggs, and they're going to get my flour, and they're going to get my Doritos, okay? So they all go and do that, and they're like, we don't have equipment. We don't have masks. We don't have gloves. We don't have hand sanitizer. There's no place to wash our hands, okay? And now we are getting sick. And because you're crowding into grocery stores, even though there were told that you need to stay 6 feet apart. But now you're crowded like sardines in these grocery stores, getting yourselves
I'm
sicker,
laughing, but don't even
right?
understand.
Like, and it's like, you know, how many people got sick at Walmart? You can't blame your governor when you stood
Right.
at Walmart for 2 hours to buy milk
Or flood beaches. Like,
or sit at the
doesn't
beach.
even make sense. And I think we saw like different levels of problems like resurfacing
Right.
also within our society too. Like from racism to ageism, I would say like
Correct.
it was somebody else's problem to so
Right.
for so long. So
Well, in the beginning, everyone was like, well, you only get it if you're old. And so let's
yeah,
just sacrifice the elders, right? Right. And then, oh, wait, there's a 25-year-old healthy lacrosse player that got ill. That sounds like my demographic. I don't like that. Oh,
exactly.
well, you know, it's only Asians that have this.
Yeah,
Oh, no Black people can get this. No, I'm wealthy. So therefore, everybody kept on trying to make it not be them.
exactly.
And then you're looking around and it is the greatest equalizer that we've known, you know, and it's just like, well, what do? We have participated in these systems that have not served us
Right,
for years,
right.
decades, generations, and have contributed to the problem where we are now.
I really hope we learn from it because we're resilient. We forget
Yeah.
this is not the first pandemic in the
No,
world.
it's not.
And I mean, maybe it's the first infodemic, right? Like there was conversations around this. There was a pandemic in 2009. I don't remember. I mean, I barely
Right.
remember, but like it wasn't like this for sure.
No.
But I really think like similarly, and we were having conversations of this in the studio too, like how we saw maybe like airlines or security systems change after 9/11. Like there is a collective trauma after something which
Very much
pushes us
so.
to innovate and solve and maybe be more mindful of things. So I'm hoping, I mean, it's unfortunate that it took this for that to happen, but I really hope we rethink some of the societal measures, how we treat environment, how we treat each other, how we react to things, right? And then also look at, oh, what are the problems in like other systems? Like first let's reconsider ourselves.
Ourselves. Yeah.
So true.
I think you're right in that it's going to be the younger generation. It always is. I think you know, because this is all they're going to know
Yeah.
of
Yeah.
like
Oh,
this
true.
process, right? And so it's just going to be one of those things where it's like it's certain idiosyncrasies that are just going to come and emerge from this. So like I was laughing and wrote on Facebook, 30 years from now, you know, there's going to be a grandkid that's like upset because their grandma yelled at them for not wiping down the groceries with Lysol, right? Like there's going to be little quirks that we're going to have
Right.
because triggering and the post-traumatic stress
Right.
disorder that we will see, where it's like, no, don't touch the grocery cart. You need to put gloves on, right?
Yeah.
And people are like, why? It's like, no, there might be something on there, like a virus that you can't see,
Yeah.
right? Like, you know, and it's like, but that's our true reality. Like, there are going to be people triggered that they don't have more than 2 cartons of eggs because what if you can't go to the grocery store, right?
So
Which is
true.
like totally different. So they're going to be like, you know, 5-year-olds and 10-year-olds. They're going to be like, oh no, there's only 8 like eggs left. Mom's going to freak out, right? Whereas me as an 8-year-old, I wouldn't have thought that, you know, I would, we'll go to the grocery store. But the 8-year-olds now are going to be like, oh, that's a big problem. I should alert somebody that we only have 8
Right.
eggs left because it means we have to do a big trip and
Oh
only one
man.
person can go into the grocery store at a time. And, you know, we should stay away from each other and we should probably put our masks on, right?
Yeah.
Like that's what they're growing up into.
Wow.
And I think that's going to shift the way that they think about things. You know, how many people are starting to build, you know, do herbal gardens now and trying to grow their own food because they want herbs. So it's not worth it. I do not want to go to the grocery store. I feel
Yeah.
sick. I feel ill and sick going in there. So maybe I should just make a little, like, you know, tin can herbal garden by the windowsill. So
Yeah.
I'll have parsley,
Yeah.
right? Like how many people are going to start looking at locally, shopping locally? What does that look like? You know, I really
Producing
pray
locally.
for,
Yeah.
I pray for the stores that hopefully can survive that have been providing us with local goods
Yeah.
for a long time, that we can still buy from them, and that we understand the importance of buying local.
Right.
And it's not just some cool small business Saturday thing that you do once a year, that it's truly the small stores that have been saving us during this pandemic. It's the grocery stores that have stayed open for us. It's the restaurants that will continue to make us food, to not treat each other like we are just disposable, and that you should be doing this because you're a machine and it's your job. And I don't care how to, like, you know, when you send somebody out to go get your groceries, understand the risk that they're taking.
Yeah.
For your family to eat.
Yeah. Yeah. So true. Well, I guess, I mean, these are just great reminders for ourselves. I also want to wrap up with an advice that you would want to give anyone who is trying to make progress, whether in healthcare or another industry. What would be your quick advice?
My quick advice is to not rest on the laurels that were provided to you when it comes to building your infrastructure for whatever company. Just because everybody has done it that way does not mean that you have to continue. Just because you have done it that way does not mean you have to continue. You cannot be afraid to pivot, and you should always be looking for ways to think outside of the box when it comes to how you build your company.
Amazing. Thank you so much,
Yeah.
Courtney. This was such
Thank you
a
so
treat,
much for-
both like really inspirational and a venting session. Like everything we needed.
Yeah, we all needed to kind of vent.
Such a fascinating conversation. Thank you so much for joining.
Thank you so much.
Thank you so much for watching this week's episode. If you found value in these conversations, please like our video and hit the subscribe button. Make sure to visit our website, podcast.what'swrongwith.xyz, and subscribe to Apple Podcasts, Spotify, and Google Podcasts so you never miss an episode. Please leave us a comment or review, or you can simply tell your friends about us. For more details on our guests, follow us on Instagram and Twitter. You can find our handles in the description below. And don't forget to join us next week.